Hello, students and staff at Jenny Hospital. Today I'll be teaching you about physician-assisted suicide. If you do not know what that is, according to the American Medical Association, it is when a physician provides the necessary means and information to further help a patient's decision in ending his or her life. Now, this isn't just for anyone. There are certain circumstances that you have to forego to access this aid. You have to have a terminal illness that um, is irreversible from treatment. You have to be of legal age and expected to die within 6 months. Um, Soon, I will be going over the pros of assisted suicide being the relief in pain, the respect for the patient, and safe practice. Some will go against this and believe that there's not enough statistics for this sort of information and that survival forecasts are based largely on past survival experiences, making it a 1 in 6 chance that the patient will make a decision based off of inaccurate prognosis and is then deemed as too high of a cost. Now we'll actually get into the pros of assisted suicide, starting with the relief of pain. As no one likes experiencing pain, this is deemed as the main reason as to why assisted suicide should be legal. As well as medicine is aimed to relieve the sufferance of patients with illnesses and diseases and is seen as humane and compassionate. 73% of participants believe that this should be legal, as if the patient is in pain and physical symptoms become too intolerable, they should be allowed to hasten their death. There is also a sense of peace of mind and control with their last days with their family and loved ones. Along with control, there's a respect for the patient. If the patient doesn't feel that their worthiness or dignity is unattainable due to their progression of their illness, there should be a sense of autonomy and self-governance over their own decision, as they want to make this sort of last decision before they have to go. With this patient's autonomy, they have a right to informed consent and are informed and explained of the risks and benefits uh, to physician-assisted suicide, and they should be allowed to have this agency to make a decision for their treatment. Okay. Moving into my last topic, being safe practice. Physician-assisted suicide gives doctors the right to ensure death in a way that suicide by other means cannot. Thus, aid in death thus becomes an option for care in dying. Now, some states do vary with this law as it has become legal, and like in California, Maine, Colorado, Oregon, etc. These states vary with their laws as they have safeguards um, that are there to prevent abuse and and provide structure for acts that some will do that are more hazardous and dangerous. Patients can also autonomously request this aid and are not forced or threatened into taking their medication themselves. And in this aid, two physicians have to determine your age, your mental health, your prognosis, your diagnosis, etc., to make sure you're legible for the aid. And you also have to have a verbal consent for this aid, and you have to have a filing and registering of prescription to even forego the aid. So, students and staff at Jenny Ed are welcome into taking the survey of helping in the legalization of physician-assisted suicide. And if you need a rundown, we went over the relief of suffering patients, the respect for the patient's decision, and the safe practice of physician-assisted suicide. Thank you.